Breast augmentation as we know it today has been around since the 1960s. Up until 1992, the majority of us used silicone gel implants. In 1992, there was a phenomenon that occurred in this country in which there are people that alleged that the silicone gels were somehow related to a group of diseases such as rheumatoid arthritis. Okay. The FDA or the government put a stop to the use of silicone gels, and we predominantly use saline implants. Multiple studies were conducted after 1992 which failed to prove a causal relationship of what was being alleged and what was actually happening. And therefore, silicone gels were placed back on the market in November 2006. Today, you have a choice between silicone and saline. So the question always arises, what is the advantage of one versus the other? The greatest advantage that the silicone gel implant has is it's more natural feeling. Not necessarily natural looking, because I could show you two pictures. One is saline, one is silicone, and you're not going to know the difference. However, to feel the implant itself, the breast itself, it may feel a little more natural. However, it does have its drawbacks. First of all, the saline implant is an empty bag that can be rolled, it can be folded, and can be inserted through a very small incision in the areola, the fold, or in some special cases through the armpit. Once it's in place, then it's filled with the desired volume of saline. Silicone is very different. Silicone, as you can see, you can't fold it, you can't roll it up, and therefore the incision has to be made slightly larger, and unless the woman has a large areola, it has to be made down here in the fold. Some women care, some women don't care. Next is that in both cases, the implant could have a failure. A small percentage of the implants will have a failure. If you have a failure with the saline implant, you're going to know right away because it's like a flat tire. You're going to go flat within hours, it's going to be taken out, and it's going to be replaced. Silicone is going to maintain shape because it does not go flat. And the way to determine whether or not a silicone implant has ruptured is to be able to do an MRI, which of course means added cost and expense in that upkeep. Next is that at the present time, the silicone gels are more expensive than the salines. I personally do not have a preference of silicone or saline, and after the patient considers everything, it is up to them to choose one or the other. Once the implant is inserted, it can be located either on top of the pectoral muscle or behind the pectoral muscle. I personally do 99% of mine behind the pectoral muscle. I feel that in the future, when the patient has a mammogram done, it's a little easier to read the mammogram. Surgery is not performed here at Imagos. We always go to an outpatient accredited surgical facility where the surgery is performed under general anesthesia administered by a board certified anesthesiologist. The recovery time is about an hour and a half. The operative time itself is only about 30 or 40 minutes. The recovery time is about an hour and a half, and then the patient gets to go home. Post-operatively, the patient is seen here in the office the next day, 1 week later, and subsequently a month, 3 months, 6 months, and a year. The eventual results of a breast augmentation is not readily seen immediately. You do need to wait a period of about 3 to 6 months for those implants to settle. Visit us today on the web at www.imagosplasticsurgery.com. We provide free complimentary consultations. You will personally meet with me, discuss your needs, your goals, and I will guide you through your transformation. We do offer financing options. So call us today or visit us on the web.